Hi there, welcome to my channel. Our today's topic is about shoulders anatomy. In this video, you will learn about joints of shoulder, ligaments, nerve supply, arterial supply, and the movements along with their muscles. There are total 5 joints in the shoulder girdle. The glenohumeral joint, acromioclavicular joint, and sternoclavicular joint are the main joints. However, scapulothoracic joint and scapulohumeral joint are the assistive joints. Glenohumeral joint is the joint formed between the head of the humerus and the glenoid cavity of the scapula. It is typical synovial joint, that means it is surrounded by a fluid-filled cavity. It is the most mobile joint with least stability, that's why it is easily dislocatable. Stability of the joint can be provided by two things: the glenoid labrum that deepens the glenoid cavity and hence provides stability to the head of the humerus. Second is rotator cuff muscle that holds the glenohumeral joint from anteriorly, posteriorly and superiorly, but not inferiorly. That's why inferior dislocation is most vulnerable. Acromioclavicular joint. The AC joint is the articulation between acromion process of scapula and the clavicle. It is a plain synovial joint. The function of this joint is to enable the pectoral girdle to follow the movements of shoulder joint, particularly when the sternoclavicular joint has reached its maximum range of motion. As you can clearly see in the diagram, the AC joint is the articulation between acromion process of scapula and the clavicle. The sternoclavicular joint is the articulation between sternum and the clavicle bone. It is the only joint that connects the arm to the body. Shoulder joint is supplied by axillary nerve, lateral pectoral nerve, and suprascapular nerve. If we talk about the arterial supply of the shoulder joint, the anterior circumflex artery, the posterior circumflex artery, and some branches of suprascapular artery make anastomosis around the shoulder joint. As you can clearly see in the diagram, the shoulder joint is surrounded by these arteries. The movements of shoulder joint are flexion, extension, abduction, adduction, lateral rotation, medial rotation, and when all these movements are combined, it is called as circumduction. Flexion is performed by deltoid muscle and pectoralis major muscle. However, extension is performed by posterior fiber of deltoid muscle and latissimus dorsi muscle. Abduction is performed by supraspinatus muscle and middle fibers of deltoid muscle. However, adduction is performed by pectoralis major muscle and latissimus dorsi muscle. Medial rotation is performed by subscapularis muscle and latissimus dorsi muscle. However, lateral rotation is performed by infraspinatus muscle and posterior fiber of deltoid muscle. That was all about shoulder joint. Hope you liked the video. Don't forget to subscribe my channel and press the bell icon to get notification of my next videos.